Hey guys, let's talk about this new healthcare proposal called the Great Healthcare Plan. It was just announced, so it's still pretty fresh, and it's not quite a finished law yet. It's more of a list of ideas that they want Congress to officially enforce. And the main goal behind all this is to make healthcare cheaper for regular people like us. So let's get into it. This proposal wants to accomplish 4 things, and I'll go one by one and describe each one. The first is to make prescription drugs more affordable. Right now, the same pill can cost so much more in the US compared to Canada and other countries. And this plan is pretty much saying, hey, drug companies, give Americans the same low price you give to other countries. And so far this sounds promising. If you have diabetes, cancer, high blood pressure, or really anything else, then at least your medication won't break the bank. And honestly, it's a little frustrating that it took this long for us to get here. I mean, if you have serious health concerns, then your battle should only be to try to get better. Worrying about bills and possibly not being able to afford your medication is the last thing anyone should have to stress over. Number 2, the plan wants to simply make prices more clear. And it's to prevent situations where you go to a doctor, but you don't know what you're going to pay until the bill shows up months later at your door. I think we've all had this happen at least once, and it's frustrating. And so this plan wants hospitals, doctors, and insurance companies to post their prices up front as transparent as possible. And speaking of transparency, they'll also require insurance companies to show us what amount of our paid insurance costs are going towards the actual visit versus how much becomes just profit for the insurance company. Moving on, objective 3 is to put money in your pocket instead of insurance companies. I believe this is mostly for people who presently qualify for ACA subsidies. How it works is the government wants to put extra money, so we can call this help money, into your pocket instead of giving it to the insurance companies. This could be a check or a deposit or maybe a health savings account. But that way, you can use this money however you please. You can pay premiums, deductibles, co-pays, or really anything else healthcare related. If you're wondering where this extra money will come from, it's basically the same money that was once used to fund those subsidies. And then lastly, objective 4 is to cut out all the middlemen who take extra money away. So if you weren't aware, there are companies that exist between you and the doctor. These people manage drug prices, bills, etc. And they take a cut of payments, but it's not going to be clearly listed on your claim, so we can call these secret payments, but they're referred to as kickbacks. But this drives the overall cost of everything up basically. And this new proposed plan wants to minimize middlemen wherever possible. And so far, this all sounds pretty good on paper, right? Well, not everyone thinks it's going to work that easily. For example, if you're really sick or have an emergency, will you have the patience and time to shop around for the cheapest hospital? No, you're just going to want to be treated as soon as possible. So price listings may not help as much as you think. Also, if healthy people take the cash and buy the cheapest and most basic insurance, then the sicker people might end up with the more expensive plans. And by then, it's a spiral. The expensive plans get pricier, so now not only are you sick, but you're paying more and more for the expensive plan. This plan also doesn't address anything about protecting people with past healthcare problems. For example, if you had cancer before, then what happens? If you need routine checkups or whatever else comes with maintaining health after a past condition, what do? Is that covered too? And lastly, there isn't much mention on keeping people healthy through preventative measures or free checkups or for help quitting smoking, things like that. These things would create less doctor visits overall, which the public would greatly benefit from. So the bottom line here is that we're promised cheaper care and more control. Some are excited because we've waited years for real change. Others say it's too vague and might end up hurting specific populations. Now, the next steps are for Congress to actually write the real law, and this is where a lot of these ideas get changed, watered down, or come to a complete stop altogether. What do you think? Does this sound like something that would benefit you or your family? I'd love to know in the comments below, and thanks for watching.